Monica Stokes, MD, in San Francisco, California. My first exposure with laser was for treatment of a shingles neuralgia. It was a severe pain in my eye, eyelid, cheek, and ear for about 4 months. I didn't get an immediate response, but about an hour later, the pain that I'd been experiencing, sometimes a lancinating pain, it went away for 4 consecutive days. And after the third treatment, it went away and never came back. And I said, oh my God, this is amazing. I've been using the laser now for almost 4 years. I use it primarily for pain relief, reduction of inflammation, and treatment of superficial wounds.
What is laser uniquely good at, do you think?
Well, it's faster. It's quicker than pretty much anything else, and it's treating the source as opposed to a narcotic. It's also non-invasive, not sticking anything into anyone. I think the future is ever expanding for low-level laser.
Well, you know my view, we're going to put one in every department of every hospital in the whole world.
I think that makes sense. If I could make that happen tomorrow, I would. I had a patient snowboarding and had compression fractures of 2 or 3 of his thoracic vertebrae. He was a side sleeper, and he couldn't even lay on his side. And the first time I saw him was about 2.5, 3 months after the injury, and he was still in such extreme pain that the only way he could sleep was on his back, and he couldn't sleep very long at that point. He was in such a cycle of pain. He was in spasm. All of his paraspinous muscles, many of the surrounding muscles were in spasm, so I treated the entire area every other day for 10 separate treatments. After the second treatment, he said he started noticing a difference. After the 4th treatment, he was able to sleep on his side for part of the night, which he hadn't been able to do in months. By the 10th treatment, he decided that he felt well enough to go back and start doing some gentle yoga. Sprained ankle sprains. After I treated him, the swelling, within 3 treatments, he wasn't getting the swelling at night when he took the boot and the wrap off, and then his mother decided that she was not going to pursue surgery at that point. And this is a kid who may have actually had surgery because they thought that he might actually have a ruptured ligament. He's able to walk without a limp and without a boot and without all of that now. That was 5 treatments in 3 weeks, because I actually have ruptured discs in my own back. Actually ruptured, not just bulging. And I haven't, I'm not going to spend another $2,000 to get another MRI. I don't need to get another MRI. I'm sitting here, and I've been sitting here all this time talking to you, and I can sit, an hour and a half, 2 hours at a conference without being in extreme pain now, and I can sit at my computer and not have to get up every, 7, 8 minutes to walk around before my feet go numb. Our job is to help people heal.